Hello and welcome to this lecture in Positive Psychology. I am Ms. Priyanka Rodriguez, an assistant professor in Kamal College of Arts, Science and Commerce for Women. Today we are going to speak about the module of self-efficacy, influence in life arenas. Now the name of the unit is Positive Cognitive States and Processes. The outline of this module is influence in psychological adjustment, influence in physical health, and influence in psychotherapy. At the end of this module, you will be able to highlight the influence of self-efficacy in all these three arenas, such as psychological adjustment, physical health, and psychotherapy. Now, self-efficacy has produced huge bodies of research both inside and outside of psychology. It has influence in the different areas of life and is always influencing the other areas yet to come. Today here in this module, we would only look at three different areas that would benefit us. So the first one is psychological adjustment, second is physical health, and third is psychotherapy. Now let us look at psychological adjustment. Self-efficacy has been implicated in successful coping with a variety of psychological problems. Lower self-efficacies have been linked with depression and as well as avoidance and anxiety. Now likewise, higher self-efficacy is helpful in overcoming eating disorders and abuse. It has also been linked with life satisfaction in variety of populations. Now, Bandura was one of the first to take this term or concept into positive psychology. Okay, and then he believed that it is a strength-based approach when he posed that self-efficacy can play a protective role in dealing with psychological problems. Further, he also emphasized to enable the enablement factors that help people to select and structure their environments in ways that would set a successful course. Positive psychology speaks about self-efficacy, and thus it says that when you have high self-efficacy, that is the time you are more confident, and you will notice that you would have less mental illnesses, or you would kind of not deal with too much of psychotherapy. Next, if we look at the physical health, we've looked at the psychological health or psychological adjustment. Now let us look at how self-efficacy helps an individual when it comes to physical health. So Maddox, in 2009, has suggested that self-efficacy can influence positive physical health in two ways. First, elevated self-efficacy can increase health-related behaviors and decrease unhealthy ones. Moreover, self-efficacy helps to maintain these changes. So basically, if you kind of take a healthy behavior, a healthy eating behavior in that matter, and you've seen that your self-efficacy kind of increases because you know that that you are keeping fit. Self-efficacy is going to help you to keep this change. It is going to help you to stay with this kind of positive health-related behavior compared to going to an unhealthy one. Now, secondly, self-efficacy has an impact on various biological processes that relates to better physical health. Now, here it would include adaptive biological processes like immune functioning or susceptibility to infections or the neurotransmitters that are implicated in stress management and the endorphins for muting pain. So the studies have found that there is a close relationship between self-efficacy and these biological processes, which help us in functioning in our daily lives. Finally, when we move to psychotherapy, now just as Jerome Frank made the case that hope is a common factor in successful psychotherapy, so too has it been reasoned that self-efficacy is a common factor across various psychological interventions. As such, self-efficacy enhancement in the context of psychotherapy not only bolsters efficacious thinking for specific circumstances, but also shows how to apply such thinking across situations that the client may encounter. Now, psychotherapy may use one or more of the following five strategies which have been discussed in this slide for enhancing self efficacy. So, firstly, in building successes. Okay, there was a study which was conducted by Holland and Beck in 1994, which said that often through the use of goal setting and incremental meeting of those goals, you can build successes. Now, using models to teach the person to overcome difficulties. So, as we know that self-efficacy is about learning from another individual or observing another individual, here we are using the models to teach the person to overcome difficulties. If a person is having some kind of difficulties, it is important for him to have a model and then to understand that, okay, this person had same difficulties or much more difficulties, and yet he has been able to overcome those. It allows the person to imagine himself or herself behaving effectively. So here in psychotherapy, if we use the concept of self-efficacy, we can allow the person to imagine himself behaving effectively. We can teach him how to behave effectively if he has a lot of self-efficacy. Now, using verbal persuasion by a trustworthy psychotherapist. We can kind of inculcate self-efficacy by trying to use verbal persuasion by the psychotherapist. If you know that there is a close relationship that has already been formed between the therapist and the client, then you can use verbal persuasion to try and get a little more confident in the client itself. Finally, it's about using techniques for lowering arousal. Here, the examples would be like meditation, mindfulness, hypnosis, relaxations. Now, why are these techniques to be used? To increase the likelihood for more adaptive and self-efficacious thinking. If you feel that you have not much self-efficacy in you, then these lowering arousal techniques can actually help you to build up on your self-efficacious behavior. Now, something important that has been researched recently in self-efficacy is about collective self-efficacy, which is also known as the latest frontier. So, although the majority work of self-efficacy concept has been centered on individual reacting to given circumstances, self-efficacy can also operate at a collective level and involve large number of people who are pursuing a shared objective. So this is exactly what collective self-efficacy is. It has been defined as the extent to which we believe that we can work together effectively to accomplish our shared goals. Now, although there is not great research which has already been conducted in this, but yet this is an upcoming field or an upcoming frontier that people are looking at, because it is very important when you work in a firm that you have your shared goals, that everyone has a shared goal, that everyone's goal is similar, and that everyone is working together to accomplish this particular goal. So self-efficacy is important here. So here we look at self-efficacy in a more collaborative manner, where you would call it as collective self-efficacy. This is my reference for this module. Thank you.